Hello and welcome. Good morning, good afternoon, good evening, wherever you are on this huge planet. Thank you for tuning in. I appreciate you. My name is Tony Jacobson, creator of Disable My Disability, and this is episode number 4 of the DMD Fit for Life Disable My Disability podcast. That's a long title. I should maybe rethink that. Anyway, we're going to get right into it because I got a brand new segment for everyone, and I like to call it Talkin' OI with Dr. Desai. Let's do it. Come on. I am here with the one, the only, the myth, the legend, Dr. Neel Desai. What's up, Doc?
Hey, how's it going?
Welcome to the DMD Fit for Life podcast, and this is a super honor and privilege for me to have you here on this Skype chat and being a part of this. And what are we doing? We're talking OI with Dr. Desai. That's right. That's the name of this segment. So we're planning on doing these for a while so we can get this information out. But first, I want to just have you do a quick introduction for everybody that does not know who you are. Tell me what type of doctor you are, what your history is with OI, where you practice at. Just give me a quick synopsis of who you are.
All right. Well, first I say thanks, Tony, for having me here. It's great to be here, and it's real exciting to do what we're going to be doing. So look forward to kind of working with you on this. So for those out there that don't know who I am or what my OI story is, my name is Neel Desai. I'm a family practice physician. I'm a board-certified family practice physician that's been in practice in Fort Mitchell, Kentucky with St. Elizabeth Physicians since 2006. And I've basically my OI story is that I have a 6-year-old son named Ethan. We call him Eve affectionately. He's got type 3, 4 OI by DNA, which we found out in utero. So basically, this is I don't have OI. My wife Debbie doesn't have OI. We've never been exposed to OI. The last time I pretty much knew anything about OI was in medical school about I don't know, 20 years ago. Is it that long? Jeez. So anyway, So last time the last time I read about OI was in a second year pathology class, and it was people with OI have blue sclera and fragile bones. That's about it, and that's what most of the medical community kind of thinks about OI. But anyway, to get back to the story, we basically were pregnant with Ethan, and we went for a 20-week ultrasound, and they found that he had there was a bowed left femur. And the first doctor said that we've never seen anything like this. It's been in 29 years of practice, and we're going to refer you to a high-risk perinatologist. So the next day we saw a perinatologist, and this perinatologist said that based on his shortened bowed femur, he had a couple of bowed tibias as well. He's got something called a skeletal dysplasia, where it's there are different types of forms of conditions that can cause delayed growth or short stature, or can have different effects. So she said basically, based on his telephone-shaped receiver, this is incompatible with life. He's not going to live. So we were kind of it was a shock, devastating, obviously. But there were a couple things. We had done some research at that time, and we knew there were a couple other things. It could be that, but we thought, there could be other. We had a great genetic counselor, and she kind of helped us kind of say, well, he doesn't have any rib involvement, because a lot of times what happens is these kids, these in utero, when they diagnose these things, the reason that they say it's fatal is because the bones don't grow around the rib cage. The lungs don't develop. Lungs need enough space to develop, and what happens? It's called pulmonary hypoplasia, where the lungs don't develop. The rib cage basically compresses it, and essentially what happens is they suffocate to death. Mm-hmm. So that's kind of what we were faced with. So we didn't really know what to deal with. So what we were dealing with. So we had a amniocentesis done. It's a procedure where they take a sample of the amniotic fluid, and then they test it for genetic conditions to see what we were dealing with. The funny part about all that is that our genetic our perinatologist didn't even think OI was a possibility. or they actually said it was a fatal dwarfism, or it was hypophosphatasia, which is can be another fatal skeletal dysplasia, or achondroplasia, which is like dwarfism. So they weren't even mentioning it. We did that research on our own and kind of like found out a parents group, a Yahoo parents group, which was amazing, which we'll talk about later.
Mm-hmm.
But so we kind of like, and then we found out that so many other parents had been in that same situation, and then their kids were born and they were breathing and they were fine, or not, they were breathing, but they were living. So we eventually, what happened was, week by week, we had all these tests come back, all these negative tests, all these these supposedly lethal conditions. They came back negative one by one. Finally, the last test came back. It was positive for OI. So he had a mutation that was seen in individuals that have type 3 and type 4 OI. So that's where we got our diagnosis. So once we had that diagnosis, we kind of like went along with the pregnancy. My wife had a baby shower. We kind of like just went along and just prepared we're having a baby. And then, so we also did our research about what were the treatments and what were the things we needed to expect when he was born. So, and we'll get into that later, but that's kind of like where we started. That, and I can still say that was the day that changed me, kind of like as a physician, a advocate, and just as a parent. Just we're first time parents, and it's like, this is something that you already want to protect your child and do what you can for them. But also it was an eye opener, because then you find out through this process how much lack of knowledge there is about OI in the medical community, and and we'll talk about stories how. After, not only was he told he wasn't going to live, they told us that, he's going to need a feeding tube, he's going to have fluid in his brain, he's going to need have a tracheotomy, a hole in his throat, and he would never walk, he would never do this, never do that, blah 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 blah. But anyway, but the funny thing is, he didn't believe any of that, and you'll see that, like, if you've seen his videos and how he's done. It's a long process. It's not hard. It's not easy, but you do it because you sacrifice for your kid and do what you can. Yeah. So that's kind of what drives me to do what I'm doing, to make a better life for him. And then, so he doesn't have to deal with a lot of these challenges I know that so many in the past have had to deal with, or to have those resources available, to know other people with OI. So that's kind of part of these projects. So part of this is what I do is, I created a organization called the Omaha OI Family Resource Fund. It's in conjunction with the Omaha Metabolic Bone Clinic in Omaha, Nebraska, with Children's over there. It's run by the director of their clinic is a very brilliant, young, innovative geneticist, Dr. Eric Rush. He's become a good friend of mine over the last couple of years, and we've kind of worked on different projects. And and Dr. Paul Esposito is the orthopedic surgeon who's done his surgery. So all of us got together. We kind of created this thing to kind of help families get to and from Omaha. And then not only that, but for research and for lay the foundation for research, awareness, and then to do new things to kind of help raise awareness and kind of help the OI community in advancing knowledge and care. So I have different social media groups. I used to work technologies like, social media, internet, to help providers, not only providers, but like families and anyone who wants to learn about what's going on with OI, to kind of what's in today, because there's people are still learning stuff from yesterday, and it's amazing how a lot of doctors still have not been updating that knowledge. So that's what part of all using these technologies to raise that awareness will hopefully kind of, my personal professional experiences will help a lot of people, and a lot of OI families and a lot of OI providers, and hopefully that will kind of change a lot of the things that kind of, like we say, we talk about, like, breaking myths instead of bones. So,
yeah, absolutely. I think it's I think it's definitely the 3-prong process. It's those of us that have OI, it's the people that their families and the people that are involved, and then the providers, the healthcare providers. Yes. It's those 3 prongs that we need to make sure the information is getting to all 3. and
Yeah.
everyone's on the same page, because what I'm finding with just my recent kind of research over the last 2 years, say, of just getting really involved in the OI community, is that everyone's on different pages.
Yes.
So
Yeah.
it just seems so confusing, and everybody wants to say, like, the people with OI want to say, well, I know exactly what to do. And then the providers say, no, I know exactly what to do.
Yeah.
And then the
Yeah.
families say, no, we know exactly what to do. And it's
Yeah.
like, look, nobody knows exactly what to do. We're
Yeah.
all trying to figure it out, and we're all, we all need to continue this conversation and talk about it. That's why I wanted to do this with
Yeah.
you, because that's the importance of this, is
Yeah.
being able to get this information out. Me personally, I have OI, and I'm doing my own kind of research and work as far as my health and nutrition and fitness is concerned. And then I'm like, well, I want to get a medical professional. And not only did I get a medical professional, you are directly involved because your son has OI, and you're involved with the clinic in Omaha with Dr. Rush. So this is a perfect situation for us to provide this information for people. And that's what I'm most excited about, because we kind of are hitting all three prongs in one shot.
I'd actually add one more.
Yeah.
So I'd say the fourth
Four.
one would be advocacy. Because think about like the OI Foundation and like the all these OI these advocacy foundations and groups. So that's kind of like one thing that I would say that's another aspect, another prong, because you have these four things. Because you're right, you have like the adults with OI, then you got the parents, kind of like you could also say like the teenagers, and then you have like, you have all these subgroups also too.
Yeah.
And then you have like, you're right, the providers, but then within that you have the orthopedics, the geneticists, the physical therapists. So part of it is that we need to have comprehensive, collaborative projects and care and goals. But how you do that is it's a challenge, because you deal with personalities, you deal with logistics, just the way. So it's and then ways of thinking, which that's a big thing also too.
Well, that's the biggest thing, is
That is
really really changing the way you think about everything. Can change the outcome. So I definitely believe that as well. I personally have not visited any other OI clinics, so I don't know how they operate. I've attended one OI regional conference here in Los Angeles and got to meet a couple of the doctors. What I'm finding is their information seems to be kind of old school. The research of this is still new school as far as I'm concerned, because just from the 70s was when it was kind of discovered and kind of started to be talked about. So to me, it's still new, but the information, and since technology and information is really exponentially growing, I feel that there needs to be fast talk about making choices and trying new things.
Yeah, and it's funny. We'll talk about things, and a lot of this applies just in general to life. Basically, but it's like the stuff like, every time like there's a medical question, to like my wife has something, she'll be like, I'll say it's this, and she'll be like, well, Dr. Google says it's this. I was like, all right. So I always have to kind of like preface it, because obviously if she asks me a question, it's like, are you asking me that as your husband or as a doctor?
Right.
Because otherwise I'll get in trouble. I don't think I can win either way. But I'm just kidding. She's great. But.
Well, that's the thing. Like, you have WebMD, right? And WebMD is like, people go there and then they think they're dying. It doesn't matter what the symptom is, right?
Someone said, every symptom is a sign of impending death. But so that's the kind of frustration. I was like, because someone will come in and they're like, what's this lump? It's cancer. I'm like, no, that's just a benign thing, or it's nothing really. But and that's kind of that whole thing is that
well, I think what's
information.
Yeah, what's happened is with the internet and everything, the information, like there's no information, and then there's too much information.
Exactly.
And now it's time to start narrowing it back down to what is useful and what is most powerful and relevant. So that's that's like one of the purposes of this segment that we're posting out on the internet. I mean, we need to have these conversations specifically about OI, because nobody's talking about it. People are, but it's very little. And I really want to get that word out there and get that message out there. So Let's talk about this lack of knowledge and lack of awareness that is, amongst medical and the general communities about OI
Mm-hmm.
and how it has really changed present day and what's been
Yeah.
happening.
Yeah. So, that's kind of part of like what I'm all about is basically there's so much lack of knowledge about, within the medical community. Like, I mean, I come from a family of physicians. My parents are physicians, they're internists. One of my brothers is a, facial ear, nose, throat surgeon. And, the other one's a gastroenterologist. And I have like most of my dads on their side are all physicians too. And it's like they knew about as much about OI when we first got this diagnosis as much as I did. Like, and my parents went to medical school like, 40 years ago, 40 years ago. And my brothers went about like 10 years ago, 10, 15 years, and then I have medical students who I teach also, and they know the same thing. So we're talking a span of like almost like 50, 60 years that knowledge has not changed.
Yeah.
And so when you don't have that knowledge because they don't, they just, all I think is blue sclera. So if you have OI, I'm like, well, let me look at your sclera. It's like, let me look at the blue sclera. It's like, and there are so many doctors who are like, well, this person doesn't have OI because they don't have blue sclera. I'm like, no.
Right. Which I don't. I don't have that.
Exactly.
And I do have OI. So
yeah, and you can have blue sclera in newborns, and it's like it's not a specific thing, but that's what they remember for their board exam or their licensing exam because it's a rare thing you only get tested on, never see the rest of your life.
Mm-hmm.
But at this point, now it's like I'm, pretty much I live it every day because I have a son with it and I'm involved in the community and we work on all these projects. So, and it's my passion, obviously. So,
yeah.
But the problem is when you don't have the knowledge and you don't have the education, that's when harmful and dangerous things happen. That's when, basically you don't get good care, you don't get proper healthy outcomes.
Do you think it's, with the lack of knowledge, are they giving care that is guided in the wrong direction, or they're not giving enough care? Or both?
I think it's a little bit of both, but I think it's also you have to assess, because the other thing, I'm a big student of like how people act with each other. What is their attitude and what is their take? That's my whole thing. I'm like, what is this person's take and what are they trying to do? And it's like, what is their motive, right?
Yeah.
So I'm always like, so part of it is with like providers, it's like, you want to make sure that they're giving a care, but I think part of it is like the best ones. And here's what I always tell anybody with OI, any family with OI, you have a great provider or great physician or great person if they are willing to be humble enough to say the following words: I don't know. Right? You got to know what you don't know, and that goes in my day-to-day practice. Like I have, even my own doctor, my own physician, who's my partner. He'll tell me like I know what I don't know, but like, it sounds so simple, but that humility goes a long way.
Yeah.
But if you say you don't know, then you know what you don't know. Then you can get to the right people who do know something and can kind of help you kind of learn to kind of, and I'll tell patients like, if I don't know something, I don't know, but I can find out about it, or you can teach me about it. You can learn, we can discuss it. But because a lot of times what happens is they'll just kind of assume things, and, just kind of like, this is the way it is. And I find that just, I don't get it, rigid. I don't get rigidity. I'm like, you can't be rigid in a world that's like this. You know?
Absolutely.
You have to think. You have to be flexible. How's that for an analogy?
Yeah.
You can't be rigid in bones that are joints that are flexible. Come on, right?
Yeah, no,
it doesn't work.
And that's a life lesson just for anybody.
Seriously.
So it's when dealing with a provider, dealing with a medical provider who, we are trusting when we go in and we're talking to like an orthopedic doctor who should know. I mean, he's had years of schooling and should know, it's okay, even from a patient standpoint, to understand that doctor may not know. But like you're saying, if he says, look, I don't know, let me find out. that's the
Just
magic right there.
yeah,
You know?
or because and you asked like Dr. Rush, like that's what makes him like Dr. Esposito. Even they'll tell you like, well, I don't know. I've heard him say these
Yeah.
phrases, and I've heard other doctors say it. That's like the greatest doctors. Like even like some of my own family, like they'll tell you, I don't know. Like if I don't know something, but you'd be surprised because it goes on so many levels. That kind of institutional and provider pride, or you can call it pride, arrogance,
Yeah.
lack of humility, whatever it is. But that's dangerous because that's when you're not willing to. That's what you go into medicine for. Why do we do some continuing medical education? To learn what's new, what's changed. And the thing that like some of these, it could be, and it doesn't have to be older doctors, or it could be younger doctors, but because you can't stereotype because they're all types. But the fact that when they don't want to learn something new, or if you give them the information, hey, this is new, this is some information from this, and then they still blow you off, and they still kind of like, oh,
Yeah.
and then they kind of say, well, I've been doing this, I have this degree and from this school and this many years of training and this, and I was like, yeah, so I was like, I don't care.
Without giving specifics, have you experienced that? Have
Oh
you
yeah,
approached other physicians that have been in the OI game longer and
yeah,
had those types of reactions?
oh yeah, all the time.
Yeah.
Yeah, since we
See.
started this thing. That
Yeah.
was it started with even like the perinatalogist, remember I told you about, that told us our son wouldn't have this. And then it started with like some of the geneticists that we saw initially. And so it was the orthopedic surgeons, and then it was like some of the some of his kind of like some of his other treatment team people. Like
Hmm.
I could just there's so many examples, but it's not just me, it's so many other parents,
Yeah.
adults, but it's kind of like that thing. And like when you tell them, and then and then the thing is, and here's the thing, this is also a red flag. I would give advice to your listeners or viewers. If you, and this goes for any person that's going to their doctor or their primary care provider, who are any doctor that they go.
Hmm.
If you go to somebody and they kind of like get offended if you question them, or if you ask them and they kind of blow you off, that's not somebody that's worth going to.
Yeah.
Because honestly, anyone that's comfortable with their level of knowledge or how they practice medicine shouldn't be offended by them. Or if someone gets a second opinion, I'm like, go. I'm like, I tell them, I said, you want to get a second, go ahead. I'm like, they're like, well, someone doesn't like me. I'm like, for whatever reason, they don't agree with me, my assessment, whatever. I'm like, all right, go ahead, go find someone else. I
Yeah.
don't care.
Yeah.
It's
Yeah.
not that I don't care, but it's just that like you have that right to kind of verify that I'm not threatened by it. You'd be
Yeah.
surprised by like, especially a lot of the there are a lot of sometimes specialists and that are very territorial and very insular in their thinking.
Yeah, I've experienced that myself. Even going to certain orthopedic. Well, the thing is that it's like I go to an orthopedic surgeon. Their knowledge and their idea of what to do, their solution to the problem is, oh, have surgery. I can,
Yeah.
I can do this
Cut like
surgical
that.
procedure on you, and I can insert this stuff into your ankle to help with the arthritis, and like that's it. I ask them, hey, well, what about supplements? And they're like, well, I don't know. But they say it in a way that's like kind of brushing it off, where it's like, oh
Yeah.
yeah, don't worry about that. Let me just do this surgery on you.
Yeah.
So that arrogance, that lack of just saying, look, I don't know. Let's figure something out. Let's talk about it. The thirst for additional knowledge.
Yeah, surgeons are funny that they're like, because we have surgeons in our family, but they're very kind of like very cut and dry.
Yeah.
Another pun.
Literally.
Yeah, but they're just like and they're just like, if it doesn't involve like using some steel or like using some tool to cut something, they're not interested usually. That's what I've kind of found, and that's how they are. That's their mindset. They're like, what do I am I going to like operate or not? If not, I have no interest in dealing with that. So, because, or like, I don't know, go talk to your primary care. Just dump it back on me, because that's just the way that's just their field. That's just kind of like, they're very, that's the way they are. They're kind of like that. ED physicians are like that too. They're very like, all right, what's the problem? Get very blunt. You know? So, whereas, sometimes primary care has a little more time, but a little more comprehensive to kind of organize everything, kind of working as like the overseer manager, kind of like the quarterback of the team, kind of like, all right, we got to coordinate this, and then go over all aspects of the care. That's why I like, like I say, I'll mention bringing like, kind of name drop like Dr. Raj, because it's like that's the mentality that he has, because he's board certified in internal medicine, pediatrics, genetics, and he kind of takes that attitude like, let's work as a team to kind of work everything together.
Right. Yeah.
We'll coordinate the orthopedics, physical therapy, if you need spine issues or whatever, eye problems or ear problems, whatever. We'll kind of put it all together.
Yeah.
But also manage it. So that is kind of like, so sometimes, it's one of those things with, depending on what field you're dealing with, it can be, that can also have an impact on the type of personality of the physician you're dealing with. So
what do you feel is a solution then with the providers, from the provider side first, because then I want to talk about from the patient side. But from a provider side, how can providers get information? What is the best way for them to learn more? What is the best way?
Yeah. So, part of it is I try to be like, what I like to be, I consider myself as like a kind of a link or like a liaison kind of thing. Like, I don't like to tell people, because people would always say, well, you don't treat OI patients, because you're a family physician, you're a parent, right? The difference is I like to be that link to other providers. So I have a close relationship with, obviously Omaha. We've also taken our son to Montreal Shriners. So the doctor's up there as well. And then there are a few other doctors locally that we've kind of like his pediatrician, and then and a couple other places we've been as well. So I kind of like, part of it is like, what I do is I try to get them, because there's a lot of range of physicians out there and their level of knowledge, and they're willing to learn about what's new. So that's the thing that gets missed and understated, because the doctors that, like we've talked about, that are humble enough to learn, those are the ones you want to keep. So what I do is I try to get them in touch with the other doctors that are good at like educating and teaching about what's new. So that would involve, obviously, Dr. Raj, who's a big thing about, he's really big on educating other providers and providing information, and how he does not only like what the research is, but what the clinical care aspects are. Because he's been treating, they see 200 kids of all types of severity a year, and they've been doing this since 2002. So they have quite a bit of clinical experience and knowledge, and they've been at it for a while. The other one is like Montreal Shriners with like Dr. Gloria, Dr. Rausch, and Dr. Fassier Galitovich up there. So they've also had a lot of clinical experience. They've been treating these kids since like the late 90s. They kind of did all the landmark studies for all the IV bisphosphonates, like pamidronate, for these children who qualified. So I try to get them in touch with those providers. But then I also kind of give them like a couple of like our personal experience. And then I also give them, but because a lot of times physicians, they're not very big on anecdotes. It's like when the patient comes into my office and like, my aunt's son, second cousin removed, thinks it's shingles. Right? Or like, I was like, okay.
You're like, yeah.
And like, what are you supposed to think? And so you can see how doctors can get that mindset. Like, what? Like, all right, apparently I don't know anything. I didn't go to medical school for anything. So there is that kind of like disconnect that, doctors do have a certain level of knowledge, and they don't want to be, that they can provide that, give some insight. But to teach other providers, you have to have, number one that's willing to learn. And that's and then provide them with the resources and the data. And then I give them like research that they've done. Like I'll provide, from the New England Journal of Medicine or JAMA or some of these, like, peer-reviewed journals. Here's the research.
Yeah.
Look at it. And then you figure out what you want to do. Talk to Dr. Rush or Dr. Rausch or Dr. Gloria, these other guys. And then you come up with a plan. And this is what we did. So I give them like three things. So I tell them, here's the research. Here's what we did. And here's what they tend to do, but you might want to discuss it with them. So that's kind of like, I use that link so that they don't kind of blow me off. And that's, because it's funny, because I've had different responses sometimes when I've tried to reach out to doctors. We're like, who's this guy? like, and they're like, what is this guy doing? So, but at the same time, but then others have been great. Like, they've been like, oh, thanks for your help. And they still reach out to me, and, they'll ask me questions. They'll say, well, this is what we did with our son, and this is what some other parents have done. And then here, talk to, these other guys who treat these kids. So that way I kind of work as that go-between that role, that niche, and
Yeah.
it's been interesting, to kind of say the least.
Now, that's on the clinical side. On the physician side, what do you feel from for the patients? Like myself, when we go in and a doctor doesn't know, a lot of it is, I read a lot on the posts and on the Facebook pages and whatnot. A lot of people experience it, and it's very emotional. I mean, we're going because we don't know. So what can we do as patients to help facilitate that knowledge to the doctor? What's the best way for us to approach that doctor and say, in a manner that will be, not disrespectful to him? You know what I mean?
Yeah. So this is what. Let me give you like an inside tip of what I did when we found out our son had this condition, and what we've done with every physician. What I've done personally with every physician I've seen with him. What we've seen. You make a basically list of questions, right? And I know doctors sometimes get a little. Sometimes we can kind of roll our eyes. Sometimes we're like, wow, there's like a whole laundry list of things because you only have a certain limited time and you don't always can get everything. But you try to, but you try to be patient and you try to answer what you can. I mean, the good doctors are, they get through it and they're constructive and say, well, we'll kind of work on things. So, but that's how the good doctors and patients teams work. I would say, do your research. Number one, whatever it is you're coming in for. What are your questions? Because number one, don't assume that the doctor knows everything. Just because that's another misconception is that, well, the doctor should know OI. I'm like, I just told you, I had 3 generations in my family didn't know anything about OI, including me, right?
Right.
So if I don't know that, and then my son, and it only became over the last 7 years that I immersed myself in this community, the knowledge, the clinical care, and the research. Then if I didn't know it, how can you expect anyone else, any other random doctors, to know it? Because they're going to have that same level of knowledge. Chances are most often. So I would try to educate them. I would basically do your research and. Pretty much like just what is it you're going in for, because don't just assume they're going to do everything that you need to be done. Are you going in because you have a specific problem? Is it something with your vision or your hearing, or do the research on that, or kind of ask questions other people, and then just, and sometimes it's funny because doctors have different reactions. Usually a lot of time when you hear that, like, well, I'm in this parents group or I'm in this adults go on this Facebook, they'll automatically dismiss it because they're just like, well, it's the internet, so they automatically assume things. But can I just make a point? I'm like, where do you read your PubMed articles? Where do you read the New England Journal of Medicine? I read it on the internet. I read them at Family Physician and all these articles and journals. That's on the internet. So I'm like, give them legitimate sources. Shouldn't be like some random, like, I don't know, weird website. But if it's a legitimate thing, if you take it from like the OIF page, or if you say, hey, look, this is a known problem with this condition, here are the reason. If you have some legitimate articles from the research, from medical journals, then you kind of have some credibility. That's what I would say. Do your research, arm yourself with information, but accurate information, correct information, well thought, well reviewed information. So you can have a discussion whether a certain treatment, surgery is right, and then challenge them. Basically, ask them, well, what's the research behind it? Because it's funny, because one of two things happens, and this is how you determine the kind of doctor that you have or provider. Either they bristle and they say, well, I know what I'm doing because I have XYZ degree and I've been doing this for blah 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 whatever. Right? How many times have you heard I have this many letters after my name? and then what? And then or the opposite is like, oh, that's interesting. Well, I don't know much about it, but teach me about it. These are the best doctors. These what we found, because we've been on both scale. We've had horrible, arrogant doctors, and we've had excellent, cooperative, open-minded doctors who are willing to kind of work. And that's the reason he's doing so well. Is he's really doing well. So, not to brag, but he's like, because he wasn't supposed to run, walk, all these things, and he, through his treatments, his surgeries, he now he has, he fractures about once a year. He runs, he jumps, he attends a mainstream school. with an aide. He has friends. He has a happy life, and
Yeah.
and he's very active. He's a rambunctious 6-year-old. So, but that's what you want for for this. You want that kind of life, but it doesn't come easy. You got to work for it. You got to. Nothing comes easy. That's like my mom says. Like my parents say. They always say nothing comes easy. You got to work hard in life, but if you're given the right opportunities and the right resources, you can go far in life. So that's kind of like the attitude we take, with him, and that's where we go. So I would say, to get back to I kind of go off a little bit, but to kind of get to what you're saying.
So you were saying to go in with research,
yes.
go in with good research, go in with some questions,
yes,
and be open to. Maybe this isn't the right provider, and just be okay with that. Because I see what happens is a lot of people, maybe their access is limited to their providers, so they get one doctor and they hate him, and then they're emotionally crushed.
Yes.
And talking from like an adult standpoint, an adult with OI, they're like, man, this doctor, and then they'll go on a rant. As opposed to, okay, that doctor's not for me, let me find another. That's a big thing, is knowing that you do have the choice, and just being like, okay, it's okay that they don't know, and I'm not gelling with them, and I'm not vibing with them, so let me just find another provider. Because I think emotionally a lot of people get stuck on, it's got to be this way, and it's kind of what we were talking about earlier, where it's like you got to be open, you got to know that they don't know what they don't know, and just move on. So I think that those are good points from the patient side, from somebody that goes in to talk to providers. So I think that's really good. I think we've covered a lot. This has been great for our first conversation. Just tell me quickly where people should go to, and I'm going to provide the link for the Omaha clinic and everything, but just tell people quickly what that's about, and where they can help out.
Yeah. So it's the Omaha OI Family Resource Fund, and it's under the charity 503c nonprofit of the Children's Foundation with Omaha Children's Hospital, and so any donations to that are pretty much tax deductible, and it basically goes to a fund to kind of help OI families for travel costs to and from Omaha, as well as help them with care, like splinting kids, as well as to lay the foundation for research and eventually, hopefully development of like an adult clinic with an adult OI clinic, which we're going to try to work with University of Nebraska Medical Center in Omaha to kind of work on that, to kind of work with them and develop that clinic over the next few years, hopefully.
So when people donate to this charity, it directly goes to care for people with OI, with kids with OI, et cetera, right?
Yeah. So it helps the families get to and for care if they need emergencies. Like we've already helped a couple families who were they needed emergency surgery for their child, and this fund helped them to get like travel costs to get to Omaha, to and from Omaha for surgery, and to kind of help because they're coming from far places. So kind of help them for a little bit for that cost, to kind of help that travel cost. So it's kind of like it's a starting point, but that we needed to start with something simple. And our plan is eventually to do bigger things, like the clinic and like more research. And that's something that still needs to be built up, and, it needs some financial assistance to kind of help, Dr. Rush to kind of develop this clinic, because there's a big need. Our goal is to do something that's really not really been done in North America before, to do a adult multidisciplinary clinic in Omaha, where these kids can, not only these kids can go when they become adults, but adults can go there and their kids can go there if they have OI. So you can have generations of OI families going to Omaha for one thing, and think about the research we could do. We could come up with so much more research with all these patients, and that's a big thing. So, and then Omaha's involved with a lot of the bigger brittle bone consortium disorder, their studies. So it's multi-level, like we talk about, multi-level, multi-layered, multifaceted. We have multiple goals, but it's kind of through one process here of funding. So we have a lot of ambitious goals. So hopefully we'll be able to do a lot over the next couple of years there.
Yeah, absolutely. Well, we're definitely going to make that happen. Where should people get in touch with you personally, how can people get a hold of you if they need to?
Yeah, so if they need to get in touch with me, there's a couple of the Facebook groups, the Dr. Desai, I have a OI informational group on social media. I've done one where there's a dad's group for fathers of children. There is also through email, you could probably get me like through drneil@hotmail.com. It's my email address. So if there's any information they're looking for there. So, okay. But probably I would say social media is easiest. Just look me up there, and if there's an EOI connection, we can connect through that. And it's easy. That's usually where it's easiest for me to connect and provide resources for people.
Awesome. Well, I absolutely appreciate you taking the time here. Talking OI with Dr. Desai is going to be a huge hit on the interwebs. We're gonna blow this thing up. I can't wait for our next conversation and in the next episode. So thank you for being with us today.
All right, thanks, Tony.
All right. And there you have it, the very first Talkin' OI with Dr. Desai. I'm so excited to have Dr. Desai available for us to do this segment so that we can talk about these things and answer some questions. In fact, if you do have questions that you might want us to discuss, connect with us on Facebook. You can get to all of the groups that Dr. Desai was talking about, as well as join me on the Health and Fitness for OI group, and also find me personally on Facebook. It's facebook.com/TonyJWorld. Also, please visit my website. It's disablemydisability.com. You can learn all about what I've got going on there. I look forward to connecting with you. And remember, it's all about living the healthy life that you deserve. We'll see you next time.